And at that point, again, I'd like to ask Professor Volker whether you want to comment a little bit on this particular case.
Yes, when I first saw this report, my spontaneous remark to our committee was, this could be a chapter in a textbook on infectious disease of ruminants. Because Hans is going to present a classical case of hereditary BVD. That means the grandmother is viremic, the mother is viremic, and the grandchild is viremic. That is something that rarely happens. And all three apparently were clinically okay until the grandmother became sick. And then Hans came into the picture and did his detective work on that.
Okay. Well, Hans, the detective, can you hear us?
Yes, I can hear you. Can you hear me?
Excellent. So,
okay. Can you hear me?
Yeah, we can. I can hear you. Yes.
Okay, perfect. Okay, thank you very much. I want to thank first Boehringer Ingelheim for this invitation to present my case in this way. About me, I'm Hans Verweij. I'm a veterinary practitioner. I'm working for Groepspraktijk Dierenarts in Barneveld in Holland, in the center of the Netherlands. And I'm working only in the large animals. And next slide. I called my case like mother, like granddaughter. And at the end of my story, you understand why this is the title of my case. The case was on a small hobby beef farm with only 3 adult cows and 1 calf. So it's quite clear structure. It has a granny of about 7 years old that was purchased 4 years ago. The granny had a daughter of about 3 years old, and she was the mother of a calf of 6 months old. So we have 3 generations of BVD of blonde Aquitaine cows. And there was also 1 Norman cow on the farm. Next slide. And the farm had extensive grazing during the summer and in a small stable during the winter time. There was no participation in health programs, but the farm has a history of Jones disease, Mycobacterium paratuberculosis. Next. So we received a call from the farmer that the granny had progressive diarrhea since about 2 weeks, a bit more than 2 weeks. It was not really sick, but it had decreased appetite and severe loss in body condition. The other animals were healthy at this moment. There were no changes in feeding or housing. They get hay of unfertilized pastures and ½ kilo of beef concentrates a day. Next. So I went to the farm for clinical examination of the granny. It was the granny that had the clinical signs, and it was really in poor body condition, about a score of 1 in a scale of 1 to 5. It was alert, really trying to kick me during clinical examination, but has no fever, and there were only minor abnormalities of the digestion tract. There were a bit watery bowel sounds, and it had watery diarrhea, but without blood or without mucus. So we have a problem definition of a 7-year-old blonde Aquitaine cow with watery diarrhea, without blood or mucus, and without fever. And for this problem definition, I make a differential diagnosis list. You can see on the next slide. And I order them from the most likely, the bigger ones on the top, and then less likely or less common to the bottom. First, infectious diseases, of which Jones disease was really on the top of my list because the clinical signs matched quite well. It was an older cow, and the farm had a history of Jones disease. It could also be a winter dysentery caused by bovine coronavirus. but was less probable because there was only one animal with clinical signs, and it was progressive since more than 2 weeks. Could also be a parasite infection. Parasite infections can cause severe diarrhea, but this was a cow of 7 years old, so it makes it less probable. And also, other animals on the farm did not have clinical signs. Also, BVD was on our differential diagnosis list. For BVD, we have 2 options. It could be an acute infection, but we did not see any respiratory signs. We did not see fever. We did not see clinical signs by the other calves or cows or calf. It could also be a persistent infection. But this was a healthy cow. It was an older cow. Most persistent infected cows does not get old. It had a healthy daughter and a healthy granddaughter, so it makes it less probable. It could also be Salmonella, Clostridium, or malignant cattarral fever, but they all 3 give acute disease, and therefore it's less probable. Then we also have a list of non-infectious diseases. You can see in the next slide. Intoxication, for example, by horsetail or senecio species can cause severe diarrhea. I could not exclude it really, but I could not find these plants in the hay. Deficiencies are also an option, for example, for copper or cobalt, although I would expect also clinical signs by the growing animals. Amyloid nephrosis is a serious option, but I could not feel an enlarged left kidney and there was no foamy urine. The ruminal movements were completely normal, and in the clinical examinations, I could not find any signs of hepatic disorders or sepsis, though I could also not really exclude it without blood testing. So the most on the top of our list was Jones disease. So we took a blood sample, you can see in the next slide. We took a blood sample for Mycobacterium paratuberculosis, antibody ELISA, and also did a McMaster on the feces. And because that was very easy to perform in our own practice, but both were negative. So, and that moment I received a call from the farmer because he was really worried because the cow was getting weaker, and also one of his calves, his only calf, was also getting diarrhea. So at that moment, we called the laboratory and asked a general blood screening for inflammatory cells, blood protein, and liver enzymes to make a differentiation between infectious diseases or non-infectious diseases. And a few days later, the result came in, and we found a lymphopenia and leukopenia. So there was a significant decrease in white blood cells. And on our differential diagnosis list, there was one virus that was almost famous of giving a decrease of white blood cells, and that was BVD. So I made another call to the lab and asked them, please, can you test, can you do a virus ELISA for BVD? And a few days later, the result came in, and BVD virus ELISA was positive. So it was quite a relief for me, I give it, but for the farmer it was really shocking. Next slide. BVD virus ELISA positive means almost certain that there is a persistent infection, but there's also a very small chance that it was a transient infection. So the farmer wants to know for sure what was happening. So we decided to take new blood samples of all the cows and the calf and to send them to the laboratory for testing for BVD virus. And as you can see on the next slide, the 3 generations of blonded Aquitaines were all 3 positive for the virus. And the Norman cow was also tested for tested negative for the virus, and we tested antibodies, and that was positive. See in the next slide, there were 3 generations of persistent infected cows. Next. Despite the supportive therapy, the granny had to be euthanized because it was really in very poor body condition. The mother and the calf were slaughtered because the risk of mucosal disease, and also the farmer does not want to take the risk that they infect other cows. And for the future, the farmer is advised to take blood or enos of the calves or cows before the introduction to the farm. And also we advise to vaccinate the animals with Bovila to prevent infection. I shortly want to discuss 2 points. Could it also be a transient infection in this case? And I would say it could not, because there was about 3 weeks interval between the 2 blood tests where the BVD virus was that were positive for the BVD virus, and most, as you can find in the literature, in a transient infection, there's a viremia for maximal 14 days. And another point I will make is that I hear a lot on the farms of farmers that 90% of the PIs die before they are 2 years old. And then I always have to say, yes, maybe that's true, but that also means that 10% will survive, and 10% will continue to spread the virus on the farm. So the conclusion of my presentation on the next slide is therefore never exclude or underestimate BVD. Thank you.
Thank you.